new fresher physios and students do what? Massage, soft tissue manipulation in the name of MFR. Many of these young physios, they are facing pain related issues. They are giving home visits to them, yet they are charging or taking a percentage of it from those. So hi everyone, this is Dr. Oneza and I'm a physiotherapist, educator and creator, and today I'm going to talk about very important topic which people and physiotherapists themselves are scared to talk about. And it is important for me because I feel that I have a platform, a voice, and I should use it to raise this concern, because it has come to my notice that it's going out of hand. And the exploitation the fresher and junior physiotherapists are facing because of this so called senior and bigger physios, it's going beyond what it is acceptable. So that is why I'm going to talk about this topic, which is exploitation of junior physiotherapist or fresher physiotherapist by senior physios. So basically, what happened is that few days back, I have been talking to one of the two colleagues. I have been talking, so many students, they message me on Instagram as well, and all these things. And it has come to my notice that many of these young physios, they are facing pain related issues in their hands and thumbs, and early onset of degenerative changes in their thumbs, that comes because of the excessive manual work that they are doing in the clinics and private hospitals. Okay, and not only this, these younger physios are facing a lot of musculoskeletal related issues because they are having back pain issues, neck pain issues, along with that knee pain, and all those conditions for which they need to pay attention on themselves. So when I heard this incidence has been increasing, and it has come to notice to a lot of people, I decided to take a little deep or dig inside it, that what's going on in the MSK field in the private market. And what I came to know is that many of these clinics, the glorified clinics, the very big clinics running in most of the metro cities as well as in other places, they are actually exploiting the younger fresher ones. Okay, and how they are doing it is that they are making them do a lot of manual work. They are the face, they are the name, they are not doing the actual treatment. They're guiding these young physios. Okay, and these young physios are doing the most of the manual work. They're doing the MFR. They are doing the MFR of the entire back for the patient, for entire hams, quads, all the places where they are having pain. They are keep on doing MFR without even realizing that this MFR does not even hold that much of effectiveness when it comes to pain relief. There are studies which are available which can show and prove that it is not that effective. And other things like your TENS, all right, and other releases like isometric relaxation, all these things are available, and they are evidence backed. They are proven by the researchers to equally reduce the pain. They have equal effect in reducing the pain when it compared to MFR. For that matter, MFR does not even have that much of quality evidences and RCTs. Okay, and yet they are making them do lots and lots of manual work in the name of trigger point release, in the name of fascia release. That is impossible, because when we are looking at the anatomy, we have the skin, we have these subcutaneous fat tissues and all these layers, and reaching to the fascia and muscle, it requires a lot more than just pressing and doing all that fascia release that we are teaching and learning, for that matter. So practically it comes out to be a little insignificant, and when you are using it just for the pain relief as a part of the rehabilitation protocol, it is exploiting. This is causing pain to the ones who are treating. Just imagine so how bad the condition is. And I had to talk something about it because this has been going out of hand, because people are now, physiotherapists themselves are now following only manual and only movement based rehabilitation. See, movement and exercises are a core component of physiotherapy. There is no question about it, there is no second thought about it. But for the pain management, you can use the modalities which have the evidences available. And why not when they are effective? Literally, I do not understand this point of you creating your own mindset about what you call these movement and manual therapy, all these things without electrotherapy, and we do not follow that. Then what are you following? You are literally just making these new fresher physios and students do what? Massage, soft tissue manipulation in the name of MFR. That's the core component that we all have been trying to remove from our field, and that you are inculcating. And don't get me started on the part of the salaries and the working hours, paying them in pennies. Okay, not only that, they're making them work extra hours, they are giving home visits to them, yet they are charging or taking a percentage of it from those. So what's the point? You are earning well, you have opened your own clinic and you are earning very well, your revenue is coming out in so much, good numbers, but what's the point of it if the people or physiotherapists working in your clinic are not, happy about it, and they are not in a healthy condition? I have seen these physiotherapists leave job because they themselves get sick, they themselves start developing pain, and nobody is there to assess and treat them for that matter. All right, they go to a different clinic, they see in their own clinic also nobody. I don't understand what's the problem with physiotherapists. They don't want to assess the physiotherapist who is in pain properly and give them the right treatment. Either they're not capable enough, I do not know, but something is wrong in the system that I find is very, very, you know disturbing for me. Because physiotherapists who suffer from neck pain, back pain, MSK issues, or anything, nobody is there to treat them, diagnose them, and give them the right treatment. And this I have seen multiple times. I have been seeing this and witnessing this since I was a student. When we were studying in BPT, that time also, so many second year, third year students, they develop neck pain because we are sitting for long hours and doing the studies in the desk, everything. So nobody, no senior physio, no consultant physio, no clinical physio, no any outside clinical physio, they were able to properly diagnose and give the right treatment to those students. I was one of the example myself, no doubt about it. And to be honest, obviously, we as physiotherapists, if we are the one who are suffering, we cannot self diagnose so many things. We may know what can be the root cause and what can be the structure involved here, but yet we need the other good skilled physio to diagnose what is going wrong with us. But that never happens, and that's why we are treating the ones who are in pain, and we are getting pain ourselves with lower pay scale, more working hours, and nobody to even listen to us and to treat our pain. Just imagine the condition. And this is happening most of the time with the younger physios or fresher physios. So I want you to be alarmed about this condition. Learn to say no, stand to your whatever beliefs that you have, okay? Even if the person whom you are working for is senior and the most senior, or maybe having the most fame in the world, ask them question about their treatment protocols, what they're following, what's the credibility, what's the evidence behind it. Do not blindly follow whatever the senior person is telling you. Ask them where it is written, what's the mechanism, what's the evidence behind it. Okay, do not worry about them firing you or then getting back at you angrily. You have to ask, it's your right. And if they are not giving the answer, that means they themselves not know what they are doing. It's as simple as that. You cannot quote this, that I learned it from so and so, when a person or another healthcare profession question your techniques. You cannot say, okay, that person taught me, so I am practicing this over the years. You need to have a proper mechanism, physiology, good logical explanation, and an evidence to back that technique, whatever you are using. Always, always remember that. And I try to teach that to most of my students who come and train under me, that even if you think I am saying something which is not logical for you, ask me question, let me explain it, or let me give you the evidence of it, whatever is going on and whatever we are treating the patient with. All right, so raise your voice now, because if you will not raise your voice for yourself, nobody else will. This is just a thing that came into my mind because I have noticed a lot of complaints from most of the physiotherapists, and this needs to stop, and you need to rise above this. And this madness, exploitation, had to have an end. And so please speak up about it, comment below if you are the one who have seen it, suffered from it, and want to raise the voice, because this video should reach a maximum number of physiotherapists themselves. See you next Sunday with another topic which is important to talk about in this field, in physiotherapy, that nobody really talks about. Okay, bye.